Hello, my name is Dr. Shahada Bulanain and I'm the correspondent for MedEdge MEA at the 4th Emirates Pediatric Bone Marrow Transplant and Gene Therapy Congress held here in the vibrant city of Abu Dhabi. I'm very honored to be joined by Dr. Aditya Gupta from India, who's an expert in pediatric oncology and bone marrow transplant. Welcome, Doctor, and thank you very much for being here.
Thank you so much for the kind introduction. And Abu Dhabi has been vibrant, as you said. The atmosphere is really welcoming. The conference has been a great amalgamation of networking, of knowledge, and it is such a great feeling that we have come all the way here to attend this great conference.
Oh, lovely. I'm very happy to hear that. What do you like most about the conference so far?
So, the topics that are there, it covers a broad array of what is there in pediatric BMT. Although I could not attend the workshop and the teaching classes that were there, but I hear that it was excellent. Few of my students attended that, and since it is being taken by experts from all over the globe, and more so the ones that are very renowned, I believe in times to come this is going to be a very sought after workshop and conference by all involved in this field.
That's an amazing feedback. Thank you very much, Dr. Gupta. Now, Doctor, let's dive into autoimmune complications in children after bone marrow transplant. What are the most common complications seen in practice?
Mostly the blood-related complications, wherein, like after bone marrow transplant, someone else's hematopoietic or the blood forming system is introduced into the patient. Now the success lies in the new blood forming system establishing in the patient as his or her own system. But if there is dysregulation in this, so autoimmunity happens, and the immune cells that are newly formed start attacking their own cells and the patient's tissues. So this leads to autoimmunity. The most common ones are blood-related complications and also thyroid, central nervous system complications, liver complications are common after bone marrow transplant due to autoimmunity.
Right, and can you tell our listeners more about your practice in India in relation to bone marrow transplantation?
So I work in the All India Institute of Medical Sciences. I'm a pediatric oncologist, and we do the bone marrow transplant for children with cancer as well as for children with genetic disorders, immunodeficiency disorders. Ours is one of the largest teaching and training hospitals in India with a very, very strong research ethos. So I bring warm regards from my country and my institute to UAE.
We're very happy to have you all the way from India. Thank you very much for joining. Now, Doctor, after observing these complications, how do you see it affecting the long-term follow-up of the patients and their quality of life? What's the impact?
So most of these complications would need some form of immunosuppressive medications to be given. And the irony is that the patient is in the hope, and the patient and the family is in the hope that they would just be recovering from this disease, only to find themselves landing in another disease, which now the doctor tells would require medications for 2 years, 3 years, or even longer. So the long-term immunosuppression decreases the quality of life of the patient and also decreases the outcomes of survival in these patients.
And what would you say are the strategies or preventive measures that are effective in tackling these challenges?
So the better that we know about the drugs and the diseases, so each individual disease should have a conditioning protocol akin to that disease, and so that it leaves the patient with the maximum chance of success and with the least chances of autoimmunity or failure happening later on. So of course, this will not be a platform to go into very great details of that, but yes, patient-specific measures as well as drug level monitoring, targeting drugs specific to the patient's disease, and and changing the medications as per the patient's requirement would be various strategies to decrease the autoimmunity post-transplant.
Right, and of course, multidisciplinary approach is one of the best approaches there in medicine now and often highlighted. How do you see it being effective in managing patients with autoimmune disease after bone marrow transplantation?
So overall, bone marrow transplantation in children or at any age is a multidisciplinary game. I mean, no one can do it alone. So without a team, we stand nowhere. So same holds true for any complication as well as autoimmunity post BMT. So since it's mediated by antibodies, and antibodies could be attacking any tissues, so very often you need the help of an ophthalmologist or of a liver doctor, a kidney specialist, or even a bone specialist. So it could vary, and a multidisciplinary care is of utmost importance in the care of any BMT patient and the complications that they have.
And that definitely helps give most optimum care and personalized care to the patient. Now, Doctor, looking at the future, what research or innovation is most promising in the field right now?
Yeah, so autoimmunity post BMTs often it merges with a very gray kind of margin with chronic GVHD. That's a very well-known complication after BMT. Whereas chronic GVHD, much has been researched and published about. The same is not true for autoimmunity. So I think in times to come, when we dive deeper into the depths and see what exactly is this autoimmunity being triggered due to, is the management different from chronic GVHD, or are the same set of drugs active, or would we need a different set of medications, would be something to look into in the future. And also genetic aspects as to why some patients go on to have autoimmunity and some patients do not.
Right. Thank you very much, Dr. Gupta, for highlighting your insights and sharing your expertise with us, and also emphasizing the importance of more research in the field.
Yep. So thank you for the lovely interview. The conference has been superb. I would again like to state that you have been a great host, and all the best for this conference as well as future conferences. And I would be looking forward to come in the future too.
Thank you, Dr. Gupta.
Thank you.
Enjoy the rest of your day.
God bless you.